Today I'm here with my patient Janice. Do you mind if I record this video for educational purposes? We're just doing an assessment of your wound here.
That's fine.
Okay, so how are you feeling? How's your leg feeling?
It's a little pain, not much.
Okay, so I have my gloves on already and the applicators are open over here. The first thing I want to do is assess the entire leg, make sure that this is the only area of problems that we have here. So I'm checking the underneath side. And this looks like the only area of a wound. So the first thing we want to note is the location of the wound. It's it's superior to the lateral malleolus. It's right on kind of the anterior aspect of her leg here. The shape of the wound also it's round. It's almost like an oval shape. The next thing I want to do is to check the pulses, make sure that the patient is getting blood flow down to her feet and her legs. The first pulse I'll check is the posterior tibialis pulse. And I have the pulse there. And then next is the dorsalis pedis pulse. And I feel the pulse right there. The pulses are kind of weak, but they're not obliterated when I put pressure on them. So I'm going to go with a 2+ for the pulses. The next thing I want to do is check the temperature. So I'm going to first check the temperature near the wound. And then just to get an idea of how the rest of her temperature is, I'm going to check out her feet. And then I'm going to check it up at her leg. And from checking the differences, I can tell that the area around the wound is a cold temperature. The next thing we want to do is look at the color. The color of the wound it's about 80% red, about 10% yellow. There's just a little bit of slough in there from the wound healing, and then we have about 10% of eschar, some necrotic tissue that will have to be debrided from the doctor. The next thing we want to look at is the drainage. There's very, very minimal drainage, just a little bit of the slough, a little thin of the yellow pus there just from the wound healing. But other than that, there's no drainage. The peri-wound and the edges, the outside of the wound and the edges of the wound. The peri-wound is, it looks dry, thin, dusky looking skin around here. But the edges of the wound look pink, so there's evidence of epithelialization there. Minus the eschar tissue here, and once that gets removed, hopefully there's signs of good healing under there as well. They're attached, and it doesn't look like there's any undermining or tunneling going on here. No edema, just the black eschar tissue here that will have to be removed. The other thing we want to look at is the measurements of the wound. So we'll do the length. First, we'll do the clock method, 12 and 6. So we'll line this up here. We'll pinch off where the wound ends. About there. We'll line it up to the tape measure. Looks like it's about 5.1 centimeters in length. And width. We're going to do the clock method again, 3 to 9. We'll pinch off here. And it looks slightly smaller, about 4.5 centimeters. And the next thing we're going to check is the depth. So we'll just pinch off here to see how deep it is. And pinching off and aligning it, it looks like it's about 0.2 centimeters. The other thing we want to check is for odor. So I'm just going to waft some of this. And it doesn't smell. It doesn't smell infected. It just smells like a normal healing wound. And then looking for any signs of infection. I don't see any abnormal redness, any abnormal pus forming, anything that would show any signs of infection.